COVID-19 death toll rises to 2,415 in India. Total number of COVID-19 cases rises to 74,281. Number of active COVID-19 cases rises to 47,480. Maharashtra continues to remain the worst affected state in India with 921 deaths. India has reported 47,480 active cases with 24,385 people discharged. 2,415 people have succumbed to COVID-19. Let's go across to my colleague Suraj Suresh, who joins us live from the newsroom with more inputs on it. Well, Suraj, the numbers continue to rise. Do divulge details about the fresh cases that have been reported.
Well, absolutely, Neha. Over the past 3-4 days, we have been seeing how the numbers have been rising, especially probably we could consider that the number which has been released today or the 24-hour detail which has been divulged now. So clearly that shows that, yes, there is a decrease in the number as compared to yesterday where over 4,000 cases were reported and probably the highest ever. So that is why in the past 1 week, we have seen the 4,000 mark being reached at least 3 times in a week. So that shows the number of cases are on the rise. There are few statistics which shows that the curve is quite steep at this point in time. That is, after Brazil, if we see that India is showing a steep rise in the number of cases. That is one. Second, even though Harshvardhan yesterday while addressing the media, he has said that the recovery rate is close to 31.7%. We are seeing that the fatality rate also has decreased, but the doubling period is somewhere nearing to what it was earlier. That is, during the month of April. We have seen the doubling period was around 4 days, but now from around 14 days, it has again reduced to 11 days. So the doubling period is a cause of concern now, probably staring at a peak in the month of June and July. Probably we will be seeing the doubling period again going back to 4 days or even for that matter 2 days. Well, that is what is being seen in US and the other countries as well, where the doubling period is quite less, close to 1 or 2 days. So that is why in India, probably now we will have to look at how we can control the spread of virus. Probably Harshvardhan has said over 100,000 tests have been conducted across of India, and not just that, he's also said that rapid testing will be done once the kits are ready. Now, ELISA kits are have been made available in India by our own pharmaceutical companies. So ELISA tests now will be taken up, and they will be going forward, and they'll be testing more people. Now, ELISA kits are the primary test which you can do. It will not be a confirmatory test. So you will be having a primary test which can show the possibility of probably identifying your contact or identifying the patient who could have contracted COVID-19. So now ELISA kits will be available. They will be taking up more tests in particularly the red zones or the red states, we could say, especially Maharashtra. We have seen how the numbers are on the rise. Over 23,000 cases being reported just from Maharashtra, and that is a cause of concern. The number of cases are on the rise in Maharashtra, so they will be keeping a close watch on Maharashtra, after which even Gujarat, they will be keeping a close watch, because over 8,000 cases have been reported, 8,500 cases have been reported, and even Tamil Nadu, for that matter, 8,000 cases have been reported. So this is the tally which we are seeing. Even though the recovery rate is close to 31.7% as compared to earlier recovery rate of 31.27%, probably there is a rise in the recovery rate because over 20,000 people have recovered. But at the same time, the doubling period should also be considered, because if the number of cases starts doubling, and if the doubling period actually reduces to 4 days or 3 days as well, that is when we can expect that we are nearing the peak. And if the peak is reached, if the second wave is seen in India, probably it'll be really hard for the officials to control if now they do not identify these contacts, Neha.
Thank you very much, Suresh, for joining us with all of those details.